They're on the scene on some of the worst days, answering calls for help 40,000 times a year.
And that puts Omaha's firefighters at risk. Disasters like this one last year at Knox Creek exposed them to thousands of dangerous chemicals.
And they live a lifestyle that feeds on stress. But a $1 million effort hopes to turn that around, all in the name of health. If it was a hot spot in Omaha over the past 26 years,
I made the Butternut Fire, the Storrs Mansion Fire, M's Pub.
it's likely Omaha Fire Captain Pat O'Brien was there. But on this day, he's here at Think Healthcare, having the most extensive physical exam of his life.
Blood draw, stress test, the body composition, audiology, eyesight. The sooner we can find it, the sooner you can start treating if there is anything.
More than 600 Omaha firefighters signed up for the massive medical exam. It takes more than 3 hours.
We identified the things that are killing firefighters is cancer. Cancer is the #1 leading cause of line of duty deaths.
Because their job takes them here.
You're exposed to all sorts of chemicals on a daily basis.
Firefighters get cancer 9% more than the general public, and they're 14% more likely to die from it. And it's a lifestyle built around hypervigilance, which is stressful.
We know that firefighters have these high risks of cardiovascular disease.
We're exposed to a lot of carcinogens, a lot of different hazards in our job, blood exposures, things of that nature.
You know, your sleep patterns are completely messed up.
The hope is that as these 32 new recruits join the fire service, disease prevention will be in their favor.
It's hard for us to tell the next generation of firefighters, come do our job. I mean, it's a great job, it's a very rewarding job, but also you could get sick from it and you could die from it.
It's why Fire Union President Trevor Towie worked to secure a $1 million FEMA grant just for Omaha firefighters' health and wellness. The city of Omaha chipped in another $100,000 toward the checkups.
You have embarked on a path that demands courage, sacrifice, and dedication.
And because of their sacrifice, the exam is free to every Omaha firefighter who wants one. Dr. Brian Poole at Think helped develop the custom physical just for these first responders.
Number one, they're starving to have this kind of health care. Ideally, what we're trying to do is prevent, not just diagnose early.
90s music okay?
They're giving firefighters information to change the risk factors they can control. Tell me about the firefighter diet.
Oh, we cook in the old style, so we're a lot of butter, a lot of salt, a lot of heavy meals.
Those with test results tell me they've already changed the way they're eating.
Let's find some trends, because maybe there's some things we can do as a department to say, you know what, if we do this, this, and this better, we're going to keep our members healthier.
It turns out the free comprehensive physicals are popular, with more than 90% of the fire service taking part. That's more than 650 screenings.
It's difficult to get 9 out of 10 firefighters to do anything, so getting 90% is remarkable.
Think of it as knocking down a fire quickly, before the flames spread.
Early detection can save hundreds of thousands of dollars detecting something sooner rather than dealing with it later.
An effort their families can appreciate for years to come, and one that's deeply personal for veteran firefighter Pat O'Brien.
We've got lots of young kids on the job, my son included, who I need to make sure is healthy through their career and keep our firefighters healthy.
So important. And while a $1 million grant won't come every year, the union hopes that a significant firefighter wellness program can be part of the yearly fire budget for Omaha firefighters.